Hi, Dr. Scott Jensen here. 'Tis the season. In Minnesota, when the state fair hits, oftentimes I will get requests for information about vaccines. Well, this year with the COVID pandemic starting to recede in the rearview mirror, we always have that question, and then we have the influenza vaccines, but we also have monkeypox vaccines. So I just want to give you sort of a quick and dirty summary from me, Scott Jensen, which does not represent medical advice to you. I am simply speaking as a physician in the trenches, and I just think there's a certain amount of information that might be helpful for you. So let's start out with influenza vaccines. Many authorities have indicated that they think the maximal, ideal, optimal immune benefit from the flu vaccine perhaps lasts 6 months. Well, in my career, very seldom do we have a flu epidemic or an outbreak before Halloween. So I always think that getting your flu shot at the state fair or around Labor Day doesn't make as much rational sense. I provide hundreds of flu shots through my clinic, as do my partners, but we typically try to shoot for late October, because then we figure that you're going to get coverage for November, December, January, February, March, and April. And we do see flu epidemics and flu outbreaks even as late as April. So I think it's sort of nice to have that maximal immune boost from the flu vaccine at that time. Who's required to have the flu vaccine? I would encourage you to make your own personal choice and check with your physician. You can look at what the Department of Health has to say, but I feel like virtually every vaccine is personal choice. And I would also say that you should not make an assumption that you can go to your doctor's office and necessarily get an exemption. I think you need to make an appointment and go talk to your doctor if that's something you're seeking. But that's the flu vaccine. Now, COVID vaccine. The CDC and the FDA have come out and they've released the COVID vaccine for this fall. And my understanding is that both the Pfizer and the Moderna vaccines, boosters, if you will, are both mRNA vaccines. Now, I believe there is another vaccine available, which is a more traditionally manufactured vaccine, which does not have mRNA. So those would be some choices there. Not all clinics will provide the COVID vaccine. Not all pharmacies will. But many clinics will, many pharmacies will, and virtually every hospital will. So I think that the COVID-19 vaccine, it's your choice. And I think you need to understand that the mRNA technology is still that which Pfizer and Moderna are using. Then turning my attention to the last one, monkeypox. I get a little nervous with the monkeypox information. I sort of feel like the World Health Organization is really pushing this hard. And certainly in my practice and the thousands of patients that I have contact with through a given year, it hasn't seemed like something that we have to let take over the conversation regarding public health. But be that as it may, monkeypox vaccine is available. Many clinics and pharmacies will not have it. You may need to call the Department of Health or your hospital or public health centers, and they will frequently have the vaccine available. Monkeypox is a disease that is contracted through direct contact. If you come in contact directly, skin to skin, with an animal that is infected with monkeypox, that would be a potential way to get the disease. Also, it's spread through intimate contact between humans, particularly sexual activities involving salivary secretions, anal, vaginal, or penile secretions, semen. Those are the ways that it typically spreads. So I think you want to be aware of that. The CDC has instructions for who they think would be ideal candidates for the monkeypox vaccine. I would encourage you to go to that. So those are the 3 vaccines I'm hearing questions about these days: influenza, COVID-19, and monkeypox. I hope that helps. Thanks. Dr. Scott Jensen.